infectious diseases at Northwestern University Feinberg School of Medicine. Good morning, doctor.
Good morning.
I recall us talking about 70% was herd immunity. Is there a higher number that we want to put on it now?
Yeah, the 70% was before Delta variant really took over. It's 99% of what's going on in the United States, and we're going to have 90% vaccine coverage to get this thing really under control.
I think people that might not be willing to get the vaccine in the first place might now say, oh, they're moving the goalposts. Now it's 90%, then it'll be 100%. We'll never get masks off. What do you say to those people?
Well, the response with the vaccines is not the same around the country or the world. In the United States, the higher the vaccine rate, the lower the number of cases, the lower number of hospitalizations, the lower number of deaths. So we know the vaccines work. To get the whole thing suppressed, you're going to have to get up to 95%, very similar to measles.
But then we hear in New Zealand, they're adopting this attitude where we're not going to beat this, so we're just going to learn to live with it. Is that something that's different than what we've been doing here?
It's basically, Robin, what Larry just said about we have to give up on eradicating coronavirus, and that it's just going to become this endemic disease like influenza. And every year, there's going to be a couple spikes. And hopefully, with the more people vaccinated, there won't be as much disease out there and hospitalizations and deaths.
And real quick, before we get to questions, we're waiting for the J&J booster. If you had your choice, would the J&J be your third pick? Does it matter?
I think the problem with the vaccines is we don't know the optimal way to give them. When the booster, who should get the booster, who should, at what age group and underlying disease condition. There may be people that the Johnson & Johnson vaccine would be the best vaccine. So it's really going to be kind of customized for the person. As far as one shot goes, the Johnson & Johnson vaccine is the best. And it also appears to hold the immunity for at least 8 months or longer. So there's some benefits to the Johnson & Johnson vaccine. It's an option, especially if you give it the right way.
All right, let's get to some viewer questions. If a vaccinated person and a non-vaccinated person get COVID, are they equally contagious? If not, what is the difference?
Yeah, very good question. Yes, they are equally contagious, and this is what changed the whole thing after we had the low number of cases in the middle of the summer. With Delta, even the vaccinated people were spreading it, and that changed everything. But there is a huge difference. You look at the 100,000 people who have died since the vaccines have been approved. 2,900, only 2,900 were vaccinated. So that's 34 times less than the unvaccinated. It's the unvaccinated that unfortunately are getting very sick and dying.
All right, next question. I am wondering when those of us who are over 60 but under 65 will be able to get the booster vaccine. I am very fortunate not to have an immunocompromised immune system. I had the Pfizer in March.
This is a great question. And, I think that everybody 12 and older should be given the booster, just like they do in Israel, which is a couple months ahead of us in the whole vaccination process. What is the difference between giving a booster to a 60-year-old, a 50-year-old, a 65-year-old? What is this big difference? There isn't a big difference. Everybody needs a booster, but we're giving it to the highest risk people first. That's a public health decision that has been made in this country, but not other countries, not all other countries.
All right, last question. Would you attend a family gathering over Thanksgiving weekend in Atlanta?
No. I think the CDC has issued guidance how to travel over the holidays. Okay, be vaccinated and wear a mask. But I would say don't go to one of these states that's really out of control, and especially if you are mixing with people that in your group that are unvaccinated. But really, the whole southern part of the United States and parts of the West and Alaska are really too dangerous to travel to.
All right, if you did not get your question answered, Dr. Murphy answers them bi-weekly on Northwestern University's Institute for Global Health Facebook page. You can also